All right, if you're watching here, we're going to talk about kidney stones, something that is very common in urology, and as a urological surgeon, something that I've taken care of thousands of times. So here we go. That's a kidney. If you're just seeing this for the first time, I draw. I've always drawn for patients, on the sheet, the cover for the table in the room, the exam table. I've always drawn on that, and it's something that a lot of times patients will take that home with them and they'll review it and stuff like that. But I've always liked to draw just because I think it helps to visualize what's going on. So, all right, this is a kidney. Now, there are kidney stones. Kidney stones it's a pebble or a calcium deposit or a stone formation that's in the kidney. Now, this is not a medical emergency. Having a stone in the kidney is not a medical emergency. It may cause some discomfort, but it's not a medical emergency necessarily. If there's blockage, I've had kidney stones that have been stuck in here, and this calyx was closed down, and you had infection and things like that in here. That's different, but that would show this area, dilated and infected and things like that. Most of the time, a stone in the kidney, it's not emergent. When it becomes more emergent is when the stone decides to move. So this stone here jumps up and over, and now it's moving. So now it's a ureteral stone, meaning it's in this tube called the ureter. Now this stone, depending on the size of the stone and how sharp and irregular it is, it's going to try to pass down through this tube. And again, it's starting up high by the kidney. It has this far to go. So it's got to move down this ureter and hopefully passes into the bladder without any problem. The vast majority of people will know they're passing a kidney stone, really because of pain. So it's flank pain. Early on, sometimes guys and gals can feel like they're sick to their stomach or they ate something bad, but then the pain kind of gets worse. It's more localized towards the side. Now, as the stone moves down through, then the pain usually mimics some of that stone movement. And so as the stone moves to the mid-ureter, that would be this. That's the mid-ureter, or the distal ureter, which is down this way towards the bladder. The pain will change from flank to abdominal to groin, and sometimes testicular or perineal pain can be due to a stone. Now, as a stone moves distal like this as well, as it's trying to pass into the bladder, oftentimes the bladder can start spasming and you can have, significant bladder spasms. And it's not because your bladder is full, but it's because this stone is irritating this bladder and the body is responding with bladder squeezing. The way you find kidney stones is nowadays a CT scan. CT scan is going to show all stones. It's going to show the vast majority of stones. And a lot of these guys are picked up in the ER. So you have pain, you get fearful, something's not right. medically, something's not right. I'm hurting. Go to the ER, you get a CAT scan. The doctor says you have a kidney stone. He gives you a prescription and says, follow up with this urologist, tomorrow or over the weekend, or get in touch with him. And so you probably have a lot of questions. So if you've had that happen, you've gone to the ER and you've had the CAT scan, you now know you have stones and you can't get in touch with the doctor, or you're looking for information, hopefully this picture alone will help you understand a little bit of your kidney stone. In the ER, there's a couple reasons to keep you in the hospital and not send you home from the ER. One is if you have intractable pain. Meaning they've given you morphine, Dilaudid, Toradol. They've given you a very good chance of improving your pain with IV medication. And despite all that medication, you're still in a terrible amount of pain. That patient would usually stay in the hospital. If there's renal failure, or the kidneys are not functioning well and there's blockage, or there's blockage of a stone in someone who has one kidney, that's someone that would typically stay in the hospital and usually be treated, sooner rather than later. Infection. This is probably the biggest reason why, someone with a kidney stone would stay in the hospital after being seen in the ER, is if there's a stone. And what this stone does is it irritates this tube, and the tube swells, and the stone is there, and the stone and the inflammation of this lining of this tube doesn't allow urine to drain down. So the kidney keeps making urine, but it can't get down and out here. And if there's any speck of bacteria, because it's not draining and filtering, there can be infection that sits up behind the stone. So you have infection in here. And anytime you have infection in this collecting system, bacteria can easily be pushed from the collecting system back through this kidney in what's called pilovenous backflow. And now you can have bacteria that goes from the urinary system, or the urine up in that kidney, and now it's in the kidney. So you could have pyelonephritis. That's an infection of the kidney. But once there's pyelonephritis spread to the bloodstream, it can be common. So usually when you have a situation like this, someone has been sick for a while. They've had fever for weeks. There's other issues going on. But again, these are sick patients. Sick patients that come in with cardiovascular depression and immunocompromised and not healthy. And really sick patients can come in with obstructing kidney stones with underlying urosepsis. I talked for 12 minutes and we haven't even scratched the surface of kidney stone, or how to manage it, or how to treat it. A lot of content. And I think for me, I need to keep a focus and kind of get things narrowed down as best as I can.